webinar today, Set Physicians for Social Responsibility, and I'll be your host today. I'm glad you could join us. Today's webinar is a special joint presentation by 4 organizations, Mothers Out Front, Rocky Mountain Institute, Sierra Club, and PSR. We're presenting highlights from our new report, Health Effects of Gas Stove Pollution. You know, many of us cook our food on gas stoves, and the gas industry has always told us that burning gas is clean. So it's kind of a rude shock to find out that, in fact, gas stoves create significant levels of indoor air pollution and can cause serious problems for our health. You know, this is a bad time to be getting this news. A lot of us, probably most of us, are facing tensions and anxiety due to the COVID-19 pandemic, and some people are actually struggling and suffering. So especially at this time when more of us are in our homes and cooking more, none of us want to hear that our stoves could be causing harm. But as we've learned from COVID-19, we just can't ignore the warnings from scientists and public health officials. It's important that we know about threats to health from our stoves, and it's important that we do what we can to protect ourselves in the moment, and then over a longer time frame, address the underlying problem of gas use. After all of us deserve to live in clean, safe, and healthy homes and communities. So you'll learn more about these issues in just a few minutes on the webinar, and I also hope that all of you will read our full report, which was just released yesterday. You can download the report from each of our organization's websites. Now we're going to hear from 5 presenters today, so I'd like to move quickly into their presentations. First, just a very few housekeeping details. The audience will be kept muted during the presentations. And if you have questions, and we hope you do, please type them into the little chat box as we go. The chat box is in the dock in the upper right-hand corner of your screen. After the presenters have all finished, I'll read those questions off one at a time and open the floor to our presenters to answer. And if we do work our way through all the questions in the chat box, then I'll invite you to raise your hands to pose a question using the little hand icon in the dock. You'll then be called on and unmuted by Julia Morgan, PSR's web manager, and you'll be able to ask your question out loud. So thank you, Julia, for that and for all of your tech support. And then finally, this webinar is being recorded. Next slide, please. It's my pleasure to introduce our speakers today. I'm going to introduce them in the order in which they'll be speaking. Our first presenter will be Brady Seals. Brady is a senior associate on Rocky Mountain Institute's building electrification team, where she works at the junction of buildings, air quality, and public health. Prior to this role, Brady spent 11 years working to accelerate the transition from cooking with solid fuels to clean cook stoves in over 16 countries. And Brady is also one of the 2 lead authors of today's report, Health Effects from Gas Stove Pollution. So congratulations, Brady, on this great report. Our second presenter today will be Dr. Lynn Ringenberg. Dr. Ringenberg is a retired pediatrician and emeritus professor of pediatrics at the University of South Florida and a former Army colonel. Dr. Ringenberg, who co-founded PSR Florida, is passionate about medical education and healthcare for underserved populations. After Dr. Ringenberg, our next speaker will be Andy Krasner. Andy Krasner, MPH, is the Program Manager of Climate and Health for Greater Boston Physicians for Social Responsibility and a volunteer with Mothers Out Front. Her work focuses on the intersection of the built environment, climate change, and public health. And Andy is the other lead author of today's report. So congratulations to you too, Andy, on the report. After Andy, we'll hear from Mark Kresowick. Mark Kresowick is a Deputy Regional Director for the Sierra Club. He is a very amateur chef as well. Now, I want you to know those are his words, not my words. Living and cooking in the District of Columbia with his wife and 2 young children, whose health and help in the kitchen are the reasons he now has a faster, more precise, safer, and healthier induction stove. Before his family upgraded, he used to invite himself over to cook with his friend's induction stove because it was more fun. Our final speaker today will be Bruce Nilles. Bruce is a managing director at Rocky Mountain Institute, where he oversees its building electrification program. He previously worked at Sierra Club, where he built and led its Beyond Coal campaign, and the U.S. Department of Justice Environment and Natural Resources Division. So let's move on to the next slide. and our first speaker, Brady Seals.
Thanks, Barb. Before I start, I'd just like to say what a pleasure it's been working with these three great organizations on the report. My first call was actually to one of the PSR member chapters in Philadelphia. And the person I talked to actually knew my grandfather, who is a doctor in the Philadelphia area, who's now 90 years old. And yesterday I had the great pleasure of sharing this report with him, which made me very proud. So just a quick overview why we decided to do this and who we are. This came up, we realized that there was a gap in information that was accessible about the health impacts from gas stoves. By the numbers, we know that there's been 40 years of research, and we decided in this latest study to focus on the last 20 years to do the in-depth review of peer-reviewed studies. We compiled thousands of pages, thousands of studies into 8 key findings. And then we wanted to spotlight some bright spots. We looked at Massachusetts, California, Canada, and the importance of focusing on environmental justice for this issue. The product is about 10 pages of text with some photos and graphs and over 100 citations, which I think just shows, we hope this is fact forward, direct and non-technical, accessible to everyone, including for many of us wanting to be able to send this to our mothers. And we had 8 expert reviewers from Harvard, Yale, University of Colorado, and these folks very kindly lent us their expertise in reviewing this report. Next slide, please. A little bit of background. These are really 3 key facts that we wanted to pull out from the report and front and center. And the first is just that we spend 90% of our times indoors. Even before these trying times, we spend a lot of our time in buildings. And the EPA states that indoors, the pollutant levels may be 2 to 5, as much as 100 times higher than outdoor pollution levels. A major source of this pollution is the gas stove. In terms of nitrogen dioxide, homes with gas stoves have 50 to 400% higher NO2 emissions than homes with electric stoves. So we felt like there wasn't quite a one-stop shop to find the information that you may need to know on the health impacts and the scientific findings about stoves. And we hope that this report provides that. Next slide. So the report is essentially a summary of 8 key findings, which we've organized from indoor air being unregulated to the different kinds of pollutants that we've differentiated in the report, to these sort of shocking visuals on the pollutant levels we can find from cooking inside could be much higher than outdoor standards. The well-documented health risks, the risk particularly to children, the importance of focusing on lower income households who could be disproportionately affected. And then the solutions. Ventilation is crucially important, but it's not a sole strategy. And finally, that electric cooking is a cleaner option. We highlighted 4 case studies of action, as I mentioned before, and then we provided practical recommendations for policymakers, individuals, healthcare professionals, researchers, and funders. So you'll hear a little bit more about this, but in summary, I would just like to say that no matter if it's in the developing world or here in the US, indoor air is so often invisible, and I think that in part, this report hopes to bring to light some of these issues and finally address urgently the need to have clean air inside the home. So we hope that you found this report useful. Thank you.
Thank you, Brady. Let's move to our next slide and to our next speaker, who will be Dr. Lynn Ringenberg. Dr. Ringenberg?
Thanks, Barb. And special thanks to the lead authors, Brady and Andy, and all of those that were involved with this study, those on the call today. It's really been an eye-opener for me. Decades of scientific research showing that gas stoves burning fossil fuels release toxic pollutants that can damage human health. And I spent over 25 years in academic medicine and years in private practice prior to that. And I can tell you that this topic is not part of medical school curricula in general or taught in most residency training programs. There is little to no public education, at least that I'm aware of, and our community leaders, unfortunately, they really think about health issues when they're making important decisions. So this is a very important report, and I'm pleased to be involved with it today. And obviously, it's our vulnerable populations that we really need to think about, and they're listed on the slide, but infants and children and those with pre-existing medical issues are especially vulnerable, and issues like asthma, heart disease, sickle cell anemia. You know, kids are not miniature adults. Kids have their own unique growth and development, their own set of needs. And in this instance, for gas stove pollution, you know, they breathe faster than adults do. Infants even breathe faster than children do. They have smaller, more sensitive airways that are easier to get plugged up. They are less able to detoxify and eliminate pollutants compared to adults because those functions are still developing in their bodies, their livers, etc. They have a higher lung surface to body weight ratio, and they have immature lungs and a nervous system and immune system that's all kind of revving up and developing. So they are at risk for any kind of pollutant. And then they're smaller or shorter, they're closer to the ground, and that's where a lot of pollutants tend to settle. So that's why we need to really keep this population of patients, if you will, on the front burner, although I know we need to be on the back burner, but for this talk. So next slide, please. Now I'll try and go through this pretty fast here. I think the report outlines all of this very, very nicely, but if you look at the two toxics that we're most concerned about, and that's nitrogen dioxide and carbon monoxide, we're going to talk about NO2 on this slide. And kids in homes where they're cooking with gas have anywhere from 24 to 42% higher chance of having asthma symptoms, either currently or lifelong. The picture here on I don't have a pointer, so the picture on the left, right below the child that's using the inhaler, that's an abnormal lung. That's an inflamed bronchiole, an airway. It's inflamed, it's scarred, it's red, it's swollen compared to the little one below it, which is a normal picture of an airway. So when kids get these issues with wheezing, asthma symptoms, asthma exacerbation, coughing, it means more ER visits, more hospital admissions, more missed school, work for parents. So there are a lot of things to think about. There's also been a lot of literature more recently really about the link between early exposure to indoor air pollutants from gas appliances and impaired cognitive functioning in the preschool years, which can ultimately lead perhaps to a higher risk of ADHD, attention deficit hyperactivity disorder, or other types of learning disabilities. So we need to really pay a lot of attention to this. There's science that shows we have increased cardiovascular effects with the pollutants from gas stoves, increased cardiovascular disease, premature death, more arrhythmias, more heart attacks, etc. So again, something that we need to pay attention to. And you need to think, with children, especially in the unborn child and the infant and young child, their brains, their nervous systems are still developing. And they are trying to make millions upon millions and billions of synapses and connections in their central nervous systems to make sure everything develops as it should. And so the last thing they need, either in utero or out, as an infant or young child, is a pollutant that might interfere with those synapses and connections. That's the concern about this early exposure with impaired cognitive function. Next slide. And when we talk about carbon monoxide, something that we don't see a lot of here in Florida, at least, except during hurricane season primarily, but carbon monoxide is really, it's a terrible gas. It's colorless, it's odorless, it's tasteless, it's insidious. It sneaks up on you and can kill you. So I think, again, I'm glad to see this really having a priority in this report. Low levels probably don't affect most people, but when they say most people, I think they mean adults. Most of the EPA studies that I'm aware of use adults as a standard, typically a 60-kilogram male. So an infant breathing at 60 or 70 times a minute may have more effect than someone breathing 12 to 15 times a minute. And certainly people with pre-existing heart problems experience more issues like increasing chest pain and fatigue. So something to be aware of. And as the CO2 levels go up, you may develop symptoms like flu-like symptoms, typically without fever or headache, fatigue, dizziness, nausea, vomiting. And again, just as the levels increase, the symptoms worsen and worsen, where you start having tachycardia, racing heart, increased memory, disorientation, loss of balance, and leading to unconsciousness, and with high levels, seizures, coma, and ultimately death. So it's a serious, serious pollutant that needs to be taken very seriously. And I think that, you know, it's our responsibility from a health perspective, at least, that we need to do everything we can to protect people, but especially children and our vulnerable populations. You know, kids are 33% of the current population, but they're 100% of the future and need to be physically and mentally healthy. And so I think this report is really going to help make that happen. And again, thanks for inviting me to join you guys today. I really appreciate it. Thanks.
Well, thank you, Dr. Ringenberg. Our next speaker will be Andy Krasner. Can we have the next slide? And Andy Krasner is up.
Good afternoon, everybody. Thank you so much for joining us for this call. My name is Andy Krasner, and I'm a volunteer with Mothers Out Front. Mothers Out Front is a volunteer organization made up of mothers and others, and we are working for a livable climate for our children. I have 2 school-age children, and I actually started to get curious about indoor air pollution because I was worried about their health. Several years ago, my mom came to visit me from Oregon, and during her visit, she kept complaining about the smell of gas when I was cooking, and I actually couldn't smell what she was smelling, so I was curious about it, and I started to wonder if it could be harming my kids. And when I started to dig into the research, I was actually floored to find out how much evidence there is that cooking with gas puts children at a higher risk for developing asthma. And I had just never heard of that. And most people I talked to hadn't heard of the risk either. Fast forward to the present, with the stay-at-home advisories in place and with schools closed, we're all cooking more at home, and most people are in the dark about the risks that come with cooking with gas. So with more cooking comes more indoor air pollution. And so I wanted to share some simple actions you can take right now to reduce the air pollution when you're cooking. It looks like some of my slide is missing some of the red marks. So I'm going to start at the bottom left-hand side and move clockwise, and hopefully you'll be able to see them. This is a picture of a kitchen, and your personal kitchen may or may not have some of these features. What you're going to want to do is start in the lower left, and we have actually a carbon monoxide detector that's right below that hood. And it won't actually reduce pollution, but it will let you know if carbon monoxide levels are being increased. If you're cooking, you can turn on the over-the-stove range hood. Using an externally vented range hood when you cook has been shown to be effective in reducing air pollution from burned gas and reducing respiratory symptoms in children. But here's the thing, many range hoods are actually not vented to the outdoors. My range hood looks almost exactly like the one that's in this picture, and when I checked, it wasn't vented to the outdoors. So if it's not vented to the outdoors, it's just recirculating the air in your kitchen, and it's not very useful at removing the air pollution. Just as an aside, All your other gas appliances, your HVAC system, your water heater and dryer are all required to be externally vented to the outdoors for health reasons. But we don't have that regulation for your gas stove or for the over-the-stove range hood. So if you don't have a vented range hood, you can turn on other ventilation. As you can see in this particular picture, to the left of the window, this kitchen has a fan and you could turn that on. If you don't have mechanical ventilation, opening a window will help reduce indoor air pollution too, for, if you open it for 3 to 5 minutes. I live in Boston and we don't typically open our windows in the winter, so many people may not be able to open a window because of weather, safety, or because the windows don't physically open. If you can't ventilate, you can reduce air pollution by minimizing the use of your stove by using electric appliances. Next slide. So we don't expect that everybody has all of these appliances, but these are some ideas for what you can use instead of using your gas stove. You can boil water you can use a crock pot or a pressure cooker, a toaster oven or a microwave. And some people have invested in single induction burners. If you're not a very skilled cook, like I must admit I'm not, a single induction or a single burner works just fine for me. While we are advocating for people to use ventilation if they have it, we know that most people don't use it because of a number of reasons. They forget, or it's too noisy, or they didn't know that it was effective. But the most effective way to reduce pollution from a gas stove is to switch out the source of the pollution. So as homes become more and more energy efficient, reducing air pollution is even more important because there's less natural exchange of air. So next slide. So the next time you're shopping for a new stove, consider an electric stove or an induction stovetop, which will eliminate the pollutants produced from burning gas. Induction stoves are as precise and fast as gas stoves and more efficient. When my 9-year-old gas stove had 2 burners that wouldn't work, we decided to replace it with an induction stove, and I have to say the cooking experience is a lot better. Before I wrap up, I just want to recognize that the burden of environmental pollutants is disproportionately borne by low-income communities and communities of color. Environmental justice communities are more likely to be exposed to both outdoor and indoor air pollution, which has additive effects. And they are more likely to suffer from the effects of air pollution, including asthma and chronic obstructive pulmonary disease, or COPD. So the responsibility to address existing health disparities from air pollution cannot be left solely to individual actions alone, although we have recommended them. People have varying circumstances, capacity, and resources to adopt these recommendations. We also need policy changes to ensure more equitable and better health outcomes for everyone. And with that, I'm going to turn it over to Mark.
Thank you very much, Andy. If you want to advance to the next slide, please. Like Andy, I have 2 young preschool-age children in my case, and can very much vouch for the better cooking experience, and most importantly, not just healthier, but safer experience with an induction stove, as the stovetop itself does not heat up. Only residual heat. So it is much safer, more fun, it boils faster, and more precise than a gas stove. In addition, electric stoves and really electric buildings writ large are better for the climate, reducing climate pollution, have the opportunity to create good paying jobs, are cheaper, more affordable to operate, and generally are better all around. So highly recommend moving forward with an electric stove. And I'm going to talk a little bit just about how policy ways we can make that happen as you move to the next slide. But the biggest barrier to improving indoor air quality, getting these gas stoves and other gas appliances cleaned up and ultimately out of homes is the gas companies themselves. Gas revenues from buildings, from homes in particular, are the vast majority of the revenues that gas companies that deliver to end users receive. This is their bread and butter. And they know that gas stoves are the key to moving beyond gas and electrifying buildings. That's because most homeowners don't think about their heating, about their clothes drying, their hot water heating, don't really care. As long as the water is hot, as long as it comes out when you need it, as long as your clothes get clean,
The
as long as
access
your
code you
home's
entered is
comfortable,
invalid. You entered
you don't
3004822. Please re-enter your access code followed by the pound or hash.
you don't need you're not thinking about your gas appliances. You don't care if they're electric or gas. But in gas
To
stove,
enable audio
people
control,
have an
please enter
emotional
your
attachment
audio.
to their gas cooking, and so the gas industry knows this and has launched PR campaigns to emphasize and highlight the supposed benefits of gas cooking. What they're not telling you is these very health effects that Dr. Ringenberg and Andy have highlighted so forcefully. We move on to the next slide. So what can we do about this? How can we overcome the power of the gas industry, in some cases where the gas industry is even charging their own customers to run these campaigns and obscure the facts when it comes to cooking with gas and cooking with electricity? The first way is to do exactly what we're doing today, is to educate stakeholders, to share this information, to push back on the false promise and false solutions that the gas industry highlights, to highlight the safety and climate threats of gas cooking. To establish partnerships, to engage with and listen to our labor partners, the workforce who's been engaged in this space for a long period of time, understand their concerns and the opportunities that are present. But most importantly, as Dr. Ringenberg and Andy both highlighted, to start with those on the front lines of this issue on low and fixed income families, affordable housing, places who are bearing the biggest brunt and the burden of both gas pollution, indoor air pollution, as well as energy and housing affordability. Talk to them, understand what their concerns, issues are, and start with solutions to electrify those communities, to electrify homes that are already struggling to pay their bills and to stay in quality housing, to improve the housing, to create programs that can do health and safety repairs, improve efficiency, and electrify homes first and foremost. To engage in rate design, engage with your public utility commissions, engage with utilities to establish rate designs that make electric stoves and electric appliances more affordable, including percentage of income payment programs that limit and cap the energy burden of low and fixed income families. To establish incentives to bring down the cost of these alternatives, including rebates and other incentives for electric stoves and other electric appliances. To start by building out our local advocacy efforts, to talk to your neighbors as you're educating, but also work together. More than 30 communities in California and Brookline, Massachusetts have worked together to actually ban new gas hookups in their communities, to say enough is enough, we're moving beyond gas, it's time to stop making the problem worse. And finally, to engage at the state level, to set climate pollution goals for the building sector, to ratchet up and improve our building codes to ensure that everyone has access to accessible, safer, healthier, and frankly, more fun gas stoves and gas appliances. Bruce?
Thank you, Mark.
Oh, yes. Thank you, Mark, and apologies to all. My phone chose a very inconvenient time to cut off. Thank you, Mark, and also thank you, Andy, whom I did not get a chance to thank earlier. And our final speaker will be Bruce Millis. Bruce?
Thank you, Barb. It's a real pleasure to join this panel today on a very important subject. And I, like I think most everyone else, was literally unaware of this issue 18 months ago. I spent most of the last 2 decades working on air pollution issues related to coal-fired power plants. And it was literally 18 months ago when I read the work from Lawrence Berkeley National Labs and others that really was raising a red flag that something was really amiss in particularly the work where they dug into looking at what happens here in California in the wintertime when we close our windows, everyone turns on their gas stove. The levels of air pollution that they were finding were ones that I had not seen anywhere across the country related to coal-fired power plants. So the two pollutants that Dr. Ringenberg highlighted, the one that really caught my attention was the nitrogen dioxide. It's one of 6 pollutants that EPA has regulated for almost 50 years as a part of the Federal Clean Air Act. It's been studied, it's been well researched, and outdoors, it's actually a remarkable success story. That is, there's not a single county in the country where today they exceed EPA's outdoor air quality standard. And to find, says Lawrence Berkeley National Lab, that as many as 12 million Californians, and by extrapolation, tens of millions across the country, were breathing levels that you can't find outdoors in the United States was just a real eye-opener and part of the impetus for today's report. So in terms of policymakers, what we have put together in the report, and this is just a highlight of a few of them, is that right now the approach to protecting, ensuring indoor air quality is protected and safe, both in new and existing buildings, is completely fragmented. There's not a single body in the country that says these are safe levels of air pollution and we should be building buildings and renovating buildings to these standards. Similarly, at the state level, it is largely, there are a few guidelines, and even those that are currently being used, and let me give you the example here in California, the state is in the middle of updating its 2022 building codes. And right now they are relying on 10-year-old EPA standard for the outdoors to determine what will be safe and healthy for a building built in 2023 that will be around for 100 years. It doesn't reflect the best science. And so that really is one of the top recommendations we have for policymakers at the state and federal level, which is there is a lot of recent science, Brady Seals mentioned. The Canadians and the WHO have been doing terrific work, really understanding the impact of nitrogen dioxide on the most sensitive populations. We need to be setting guidelines that then inform all the decisions we're making around new construction and renovation of existing buildings. So that is first and foremost, and it's an issue in every state. Secondly, once we are clear on what is a safe and healthy level for indoor air quality, making sure that all of our building codes, which oftentimes are set at the local level as well as the state level, are indeed being built so that we are not creating buildings today that we know objectively are going to create problems for the tenants decades to come. The third, and this is really putting the onus on the manufacturers. There have been studies and reports, as Brady said, for over 40 years. Back 34 years ago, the Consumer Product Safety Commission, who is charged with protecting consumers from dangerous products, asked US EPA, are gas stoves and levels of nitrogen dioxide a problem? And EPA wrote back saying, absolutely, there is some considerable scientific basis to be looking and trying to understand this problem and protecting consumers. There are no warnings today on gas stoves that you should vent, regardless of whether you're boiling water, baking bread. Anytime you turn on that gas stove, it is critical that there be some way to get that pollution out of the home and not concentrated in your kitchen and throughout the building. The other items on this list, and this really touches on the fact, particular time when there are 30 million Americans who are really struggling out of work and the whole other myriad of problems associated with the pandemic, is helping people make this transition, building back better. Whatever we do going forward to help people get out of this economic and public health crisis, how do we help those who most need it financially to make sure our federal and state resources are helping with financial incentives and other grant programs to help the transition from gas to low or zero pollution alternatives. Public buildings, we spend a lot of money on publicly assisted programs, we should be making sure that those are all aligned with our public health goals. We should not be installing appliances we know objectively are creating health risks for tenants. And then lastly, when you move into a new home that was built before 1978, when we banned lead paint, you're required to get a warning. Be very careful around old windows, old doors, and if you see chipping, peeling paint, do something about it, because lead paint is a big problem in millions of homes. There's a good argument, and we're putting it forward in this report, that landlords should similarly warn tenants that you should be using ventilation and a whole bunch of other measures that Andy laid out to really minimize exposure anytime you turn on the gas stove. And the other option, of course, for landlords is to help tenants by either replacing the gas appliances, offering induction cooktops, but most importantly, making sure that if the gas stove is going to be there for a while, that is indeed vented, we get that pollution outdoors, not concentrating in the place where we are now spending upwards of 90% of our time. So those are a few of the recommendations. It's a patchwork of existing policies across the state and at the national level. And we're very hopeful that with the release of this report from an amazing coalition, that in fact we spur a very important conversation that we need state, federal, local leadership to really fill in these gaps and making sure people are not being exposed to dangerous levels of pollution that you literally don't find outdoors anywhere in the United States today. Thank you.
Thank you, Bruce, and thank you to all of our presenters. We'll turn now to some of your questions. I'll be reading them out of the question box. The first question comes from Howard Kessler, and he says, one of the presenters suggested that induction stovetops are a safer choice. I'm concerned that the ICNIRP has stated that this technology, the induction stovetops, emit higher levels of non-iodizing radiation than considered acceptable for risk. Do we have anybody among our presenters who knows about non-ionizing radiation from induction cooktops? I recognize it's not the central topic of our presentation today.
No, but this is Mark. Since I made that comment, I'll just clarify, specifically referring to the heating side of safety. As you can see in the picture in my presentation, my preschool children like to help, and I put that in parentheses, air quotes, our cooking. And one of the really wonderful things about induction cooking, and the reason that my wife insisted we change more quickly, is that the cooktop itself does not actually heat up. So there's a much lower risk. There's some residual heat from the pan, but only the pan itself heats up and the food heats up, not the cooktop itself. So it cools down much faster, and there's a much lower risk of incidents in regards to burns and other safety concerns, as well as just not having gas, carbon monoxide, all the other health risks. It's just simply a much lower safety risk.
Thanks for that, Mark. Our next question is, are your conclusions about hazardous gas release and exposure from data from Western countries, that is to say North America or Europe, or worldwide? So perhaps one of our two co-authors, Brady or Andy, could jump in on that and reflect on the sources of the data that you were basing the report on.
Sure, this is Brady. I can jump in, and Andy, feel free to add. So for this report, we chose to focus on just North American studies. So this is US and Canadian studies. However, in the process, I have amassed a large library of studies from the UK, from Europe, from Australia, and in fact, one very interesting one from Australia, which we chose not to include, that was able to find that 12.3% of the childhood asthma burden in Australia is attributable to the gas stove. We don't yet have that number for the US, but we know that it's not zero. And so I think in the future, it would be very interesting to do more of a worldwide study. There's quite a bit also from Asia and a lot more. So if that is something interesting, I would be happy to send through links to some of these publications.
Great, thank you. We can see if we can perhaps get those available and send them out to the people who have registered for today's event. Here's another question. It says, there are biomarkers one can measure from EMR exposure at the levels at which we are being exposed. Apparently, there are thousands of publications, according to researchers. There's not really a question posed here. I wonder if anybody has any comment on biomarkers for EMR exposure. Well, let's move on. I'm sorry, do we have an answer there?
No, I just, this is Mark again. I'll just highlight one other safety issue with gas. I mean, as folks in the Merrimack Valley in Massachusetts know very well, gas explodes. There's a gas leak or an explosion that's, explosion or a gas leak that sends somebody to the hospital every 4 days in this country. So just, again, the safety issues with gas extend well beyond just the health issues that we're talking about here.
Okay. Here's another question. You cite numerous research studies. Why has this research gone unrecognized if it has existed for so many years?
This is Bruce. Let me take a stab at that, because that is an issue we have been really trying to understand as well. And I think the anecdotes we have thus far, it's not dispositive, but the anecdote thus far is that there has been, as Brady laid out, and Andy, this 40+ years of studies. And if you go and look at the websites of the likes of U.S. Environmental Protection Agency, Housing and Urban Development, Consumer Product Safety Commission, California Air Resources Board, they all talk about the burning of fossil fuels inside a tight building is a really bad idea. And so we've been talking to a bunch of indoor air quality experts, including the long list of reviewers you saw on the first page. And it was interesting, a couple of them, 3 of them independently all said, the way we have been making policy on indoor air quality is through consensus-based standards set by standard-setting bodies like ASHRAE and other building experts. And they all said to a T that in all of these proceedings, the gas industry has been very active at pushing back on any efforts to try to do anything about gas stove pollution, including, because these are consensus-based processes, withholding their vote, if you will, on moving this forward through the traditional standard-setting body. So that was alarming to hear that from researchers in Colorado, on the East Coast, one here in California, that they have all been trying to take this research and do something through the sort of orderly process of how building policy is getting made. And I think really underscores why this report is so important, because that process is not working. This stuff happening behind closed doors and the conversations that are happening have clearly left a lot of people exposed to dangerous levels of air pollution. And our hope is with this report, we shine a bright spotlight and get sunshine on this issue so that we can have a more fact-based policy conversation around, wow, the science is really raising a lot of alarm bells here, and it is time to fill in the gaps, policy gaps that mean that we have literally tens of millions of Americans who are breathing levels that would be unsafe. So we need to get it out of the behind closed doors and have an open public conversation around this problem that has really been in plain sight, but we have not really helped amplify.
Thank you, Bruce. Here's a question for Dr. Ringenberg. You talked a lot about the dangers for children. Can you talk more about the risks to adults?
Yeah, obviously as a pediatrician, I focus more on babies and children, but I like adults too. Yeah, the biggest thing is adults with pre-existing, I mean, the biggest risks, I think, are with adults with pre-existing medical conditions like COPD, like asthma, heart disease, sickle cell anemia is the big issue, especially in the African American community, because of the issues with carbon monoxide. It can cause issues for those folks. So I think that the dangers are probably there with with adults, but not to the level as they are certainly with healthy adults. I mean, a healthy adult being exposed to a carbon monoxide at high levels, yes, they're going to get sick, and potentially, they could die. But I think that the biggest issue again is probably with our children, our infants, perhaps pregnant women. I don't think there have been many studies, at least for indoor pollution and pregnancy. There have been some for outdoor pollution, and I think so yes, there are risks to adults too, even healthy adults.
Okay, thank you.
And I don't know, Andy, you may want to contribute to that. I don't know. You looked at a lot more of the literature than I did.
Yeah, the best studies show that children are the highest risk group. They're more likely to have respiratory illnesses and more likely to actually have more severe asthma symptoms if they do have asthma, and they're more likely to actually be at risk for getting asthma. So children are at the highest risk of all the groups, but there are adult populations who may have underlying health conditions like chronic obstructive pulmonary disease, which someone with that type of disease would be much more sensitive to nitrogen dioxide and the effects of it.
Thanks, Andy. Here's a different kind of a question. Somebody said he's looking at buying a high-end induction cooktop. He says my 4-burner Bosch cooktop would cost $2,049. And that's definitely a high-end one. He said, I reached out to a friend in Switzerland who has a Siemens, the same as the Bosch induction, with 5 burners. I asked her what it cost, and she said $1,200. Why the price gouging in the United States?
Barb, this is Bruce. We have been looking at that very issue, and we looked at what is the lowest cost induction range in Europe, where they're very common, and it turns out they're literally half price, very similar to the story you just recounted, and it's simply because they're more mainstream. Here, because induction is such a superior product, it is seen as a high-end option, and many retailers only sell high-end induction stoves. So it just takes a little more digging and work to find the more affordable ones. And our hope is that as we begin to have a more vibrant conversation around the need to reduce gas stove pollution, that the manufacturers will respond to that need and offer the same product they're selling across Europe and help make all this as affordable as possible.
Well, that would certainly be very welcome, and I hope that our report helps to move us in that direction. Somebody else asks, as a constituent, what's the best way to make my voice heard to both federal and local policymakers to encourage them to adopt your policy recommendations?
This is Mark. It's a great question. A lot of it's going to depend on where you are, what the particular opportunities are in your local community. At the federal level, certainly looking ahead to future opportunities for the federal government to support states who are leading and providing incentives and rebates for these products, as well as support states in more advanced building codes. There's going to be potentially there's always the opportunity for the federal government to really support states in moving forward. And then Bruce can certainly might want to speak to some of the potential for limiting air pollution if you'd like to. But the best way to make your voice heard is to, as we highlighted, work with your local partners, reach out to groups like labor, affordable housing, et cetera, and to organize, to communicate with your decision makers at a local and federal level, to get your friends to communicate to do it, to if you do have an induction stove or know somebody who does, hold a house party once we're able to actually meet up again, or a virtual one. We're thinking about virtual cooking demonstrations here too. So a lot of great opportunities to engage, but ultimately, especially in this time where we're stuck at home, communicate with your decision makers, and happy to provide some action alerts as a follow-up as well.
Great, thank you.
Let me just add, we have 3 amazing grassroots organizations on this call. Physicians for Social Responsibilities, Mothers Out Front, Sierra Club, they all have local groups and chapters who are doing amazing work. It's an awesome opportunity to get involved locally, and I couldn't recommend those 3 organizations enough.
Thank you, Bruce. Here's a different question. Is there any hazardous emission data on biogas versus fossil fuel-based gas?
That's a great question. This is Mark again. Actually, we're going to be releasing a report in the coming weeks on biogas specifically. It's important to note, though, that biogas is just methane. It is the same product ultimately moving through the pipes as gas. And so it comes from a different source. It's not, drilled from out of the ground. It's created differently, but it's still ultimately the same fundamental product. So burning it inside a home has essentially the same impacts. It leaking out of the system has the same climate impacts. It's a different source, but ultimately it's essentially the same product.
Okay. Our next question is, most professional kitchens are required to have CO or carbon monoxide monitors near the stove. With levels of gas not being vented outside and not triggering the monitor, still be at levels that are of risk to a chef?
This is Brady. Potentially, one of the things I was so surprised at during this research was the levels that most smoke alarms and carbon monoxide detectors are set at are much below where certain individuals, especially those with underlying conditions, can feel the effects. So if you've had a chance to look at the report, there's one chart in particular where we highlight the UL rated carbon monoxide detectors, which most of the ones in the States must meet, and then what health effects can be for certain populations. It's very stark. So you can get lower level alarms that will alert you if it reaches a significant level, but it's something that's not standard. And so I would encourage you to look at that chart. And for chefs and for those who are working in the restaurant industry, I do think it's something to be thinking about, that we may not hear the beeping of an alarm at the level in which we feel the effect.
Thank you. Next question is, my region is off the gas grid, and many cook on gas stoves converted to run on propane. Are the risks the same or similar for propane stoves as they are for gas?
This is Andy. We've actually received this question before. It's interesting, when we've looked through the studies that were done, the studies are done with gas stoves, but propane and gas are made of similar carbon products. And so when you burn them, they have similar byproducts of nitrogen dioxide and carbon monoxide. We don't know, I personally wasn't able to find how burning propane differs in the amount of nitrogen dioxide versus a gas stove. So it's hard for me to answer exactly, but you would still find nitrogen dioxide and carbon monoxide as a byproduct.
I would echo Andy's and also let you know that the World Health Organization in 2010 put out a major report, and a large section was on nitrogen dioxide. It's called Selected Pollutants, and in there they do pull out a few different studies from Hong Kong and other areas that look at propane and look at this issue. We didn't study it in this report, but that would be a place to go. And also to just make a note that around the world there's a push towards cleaner fuels. It's a continuum of going from the health damaging particulate matter and PM 2.5 that's mostly found in wood towards the cleaner fuels. And there's a major initiative underway called the HAPPEN trial that's actually looking at LPG and propane compared to others. So we should have some data out of there. One thing I want to highlight is that NO2 is a completely understudied pollutant. Even in the 2016 Integrated Science Assessment from the prior 2008, every single organ in the body and the health effects was essentially strengthened. And in 2016 from the EPA, that's where we find a causal relationship from small doses of nitrogen dioxide to the respiratory health effects, and for cardiovascular and others, it's suggested or very likely or likely. So just to highlight that I think some of this research on nitrogen dioxide is new, and this is a pollutant that we're starting to pay more attention to. So just to highlight that the HAPPEN study may be a very interesting place to look in the next couple of months.
Thank you. We have a request from one of our listeners and a very useful reminder to talk about the companion report. I believe this is the one that was just published by UCLA called Residential Gas Appliances. Oh, wait, I missed part of the title. Well, Residential Gas Appliances on Indoor and Outdoor Air Quality and Public Health in California. And I think we may have a couple of people on this call who actually contributed to that companion report. Would you like to tell us a few words about it?
I could go. This is Brady again. Anyone else feel free to jump in, but I'll give you my top levels of why I think this is a fantastic report and a great contribution to this space. So in this report, UCLA looked at what are the effects of all of our gas appliances, the stove, the water heater, the furnace, on the indoor air and the outdoor air. And to me, the top level from the indoor was they found in 90% of the cases when you cook inside, whether that's an apartment, a single family home, or a townhome, 90% of the time, the nitrogen dioxide levels were higher than outdoor standards, which are also outdated, but that's another story. And the most impactful was the small apartments. So the smaller, older apartments, 98% of the times that number was exceeded. So it really gets into this equity issue and the need to focus on lower income households. On the outdoor piece, they were able to measure through emission factors, and this is also caveated by saying this is assuming all emissions are vented to the outdoors, because we don't have a good way yet to capture at a state level what that will look like indoors. So if all these emissions were vented outdoors, that would lead to 350 premature deaths every year, and the monetized health costs of burning gas in buildings is $3.5 billion a year. So I think this is a really interesting piece. It's pulling just gas from just the residential sector, starting to monetize those costs outdoors, and really highlighting the work that is still to be done to quantify that indoors. So it's a great contribution and very timely.
Thank you. Speaking of the other sources of gas burning in our homes, here's a question that says, what should we think about gas heating and gas fireplaces? And I know one of you did mention that gas furnaces are required to be vented to the outdoors, and that certainly is an important factor. But what about gas fireplaces?
Unvented gas fireplaces are certainly an issue. There's been a couple great studies actually coming out from Shelley Miller and her group in Colorado that looks at and measures the impact of unvented gas appliances. One of the things we know is that these are often used and on for longer times than the stoves, which can get into this whole thing of time, minutes times exposure equals risk, right? And so I think that there's certainly a lot of data out there on that piece. I would also say, and this goes back to a different question, that there is some information on heating, gas heating, and in particular from the UK and in Europe, and how that affects children in schools, and actually finding that brain development and other issues can be impacted from burning gas and some of those emissions from commercial heaters in buildings. So I think this is highlighting that there's some more future reports down the line to look at some of these other appliances indoors, and also some of the other schools and commercial buildings.
Thank you. I think we have time for one more question, and here's a question that reminds us about some of the other potential threats to health that are associated with methane gas or fracked gas. It says, as you know, shale gas formations like the Marcellus Shale are highly radioactive. Is there research showing that the gas coming out of my stovetop could be radioactive? Do you have any takers on that?
There was a group that gave a presentation at a conference in Boston a couple of years ago that they were trying to characterize what is coming out of gas stoves. And I know that they have not published that work yet. So what I would say is it's coming.
Okay, well, that's good to know. We've exhausted our time. I'm very sorry for those of you who submitted questions that we weren't able to answer, but thank you all so much. Thank you, our presenters, for being on the phone with us. Brady Seals, Dr. Ringenberg, Andy Krasner, Mark Kresowick, and Bruce Nellis. And of course, for all of you who are here as our audience, thank you so much for joining us. Stay safe and stay well.